Namaste, myself JVWU Gaurav from the Faculty of Physiotherapy and Diagnostics in the discipline of Radiology. हमेशा खुश रहो विद्या. Today we are going to discuss about the session, the beam directing devices, or especially the tissue compensator. Tissue compensator. So, beam modification device is defined as beam modification device is defined as desirable modification in the spatial distribution of radiation within the patient by insertion of any material in the beam path. Like if we insert any shielding block, compensator, any type of phase filter, or any type of absorber that absorb the beam and modify the distribution of the radiation. There are four types of beam modification device or beam modification devices. First one is shielding, second one is compensation, third one is phase filtration, fourth one is flattening. Okay, so these are the four inserted mechanism in beam paths. So let me discuss about the compensator, tissue compensator. Beam modification. It is a beam modification devices which even out the skin surface contour while retaining the skin sparing advantage. Okay, it allows normal depth rose data to used for such irregular surface. So it is used to in the case of irregular surfaces. Compensator can also used to compensate for tissue heterogeneity. Heterogeneity means the distribution of tissue is not same manner or not the same. This way the primarily used this was primarily used in total body irradiation to compensate for those irregularities arising due to reduced scatter near the field edges and horns in the beam profile. So tissue compensators compensate the regular surface when we are treating when we are treating the uh, the uh, whole body irradiation, or when we are treating the whole body. Okay, so next we are discussing about the bolus. Bolus bolus is also a bolus is also used for or to remove the irregular surfaces, irregular tissue shape. It must be possible to mold the bolus to fill the tissue space. It is loosely packed in polythene bags, shape of the skin surface. These bags are usually smooth to achieve a flat surface. So it convert uh, irregular surface into the flat surface after using it on the skin surface, modifying those at a skin surface and depth. So uh, uh, the bolus is made up of gauze, wax, or tissue equivalent material. So the gauze, wax, and uh, any other materials perspex bolus is used. So these are the material that used to make the bolus. So other uh, other beam modification devices or beam modification techniques are asymmetric jaw, multi-leaf collimator, flattening filter, flattening filter, and field shaping blocks, custom blocking, and wave filter. So let me discuss about the uh, asymmetric jaws. It is used when technician want to block of the part of the field without change without changing the position of the center. Independently movable jaw. So it is used when technician want to block the part of field without changing the isocenter. Independently movable jaw allow us to seal a part of field of view, part of field. Okay, like if we open two jaws like X or Y jaws, then we can block one part like X1 or Y1 part of jaw to block the field, and this can be used for beam splitting. Here, beam is blocked off at the central axis to remove divergence. Use of asymmetric jaw results in the shift of isosceles curve. So it will reduce the shift of isosceles curve. Uh, this is due to the elimination of photon and electron scattered from the blocked part of the field. So next we are discussing about the flattening filter. A beam flattening filter reduces the central exposure rate related to that near the edges of the beam. Okay, so flattening filter reduce the central exposure rate, but uh, but it accept the edge of the beam. Okay, so flattening filter reduce the central exposure rate or uh, beam central beam to convert or change the shape of the isosceles curve. If we are not using the flattening filter or without flattening filter, the shape of the isosceles curve is conical. So we are going to use a flattening filter to change the shape. Okay, due to lower scatter, the isosceles curve that exhibit forward peaking. Forward peaking. The filter is designed so that the thickest part in the center material used copper or brass. So flattening filter is made up of copper or brass material. Next, we are discussing the field shaping block. The field shaping blocks help to minimize the dose to helps to minimize the dose to the normal tissue as well as the vital organ, the shaping of a treatment. So it is used to minimize the dose to the normal tissue or surrounding tissue or vital or critical organ. The shaping of the treatment field is decided by the target volume. Field shaping can be done by the shielding blocks made of lead. The thickness of lead required to provide adequate protection of shielding area depends on the beam quality and allowed transmission through the blocks. So, a primary beam transmission 5% 5% through the block is acceptable for most clinical situations. So primary. In the case of primary, there is a accepted there is a uh, uh, accepted leakage is 5% through the blocks. Thus, a thickness of 4.5 to 5 SVL of lead would give less than 5% primary beam transmission. So 4.5 to 5 SVL of lead would give less than 5% primary beam transmission. The lead blocks are usually placed placed above the patient on a transparent tray between the path between the source and the patient. On a transparent tray, these blocks having some screws, so these are fitted on the transparent tray, plastic tray called shadow tray. The tray is called shadow tray. The blocks should be shaped or tapered so that their sides follow the geometrical divergence of the beam. The however divergent block offer little advantage over coaxial beam since it has large geometrical penumbra. So this is the field stopping block. Field stopping block is used for shape the field or reduce the reduce the dose or exposure to the normal tissue or critical organ. After applying or insertion uh, after insertion of the shielding block, the intensity of the photon is reduced. Custom block. Custom block is made by low melting alloy called lipovids metal. This material consists of 50% bismuth, 26.7% lead, 13.3% tin, and 10% cadmium. These are the material that is mixed in this alloy, lipovids metal, or custom blocks are made up of lipovids metal that is a low melting alloy. It melts at about 70 degrees Celsius and therefore can be cast into any shape at room temperature. Uh, at room temperature, it is harder than lead. It is harder than lead. Hmm. The minimum thickness required is 7.5 centimeter for mega voltage photon beam. So minimum thickness required for is 7.5 centimeter for mega voltage photon beam. Okay, so in this session we had discussed about the custom block, shielding blocks, compensator, at first compensator and bolus. So this session is particularly important for radiotherapy applications or shielding material that is used in the radiotherapy to shield the normal tissues and by according to the shape and uh, according to the shape and the critical organ or vital organ. Okay, I think you are satisfied with this session. If you have any queries, then put it into the comment box. I'll resolve it later. Thank you. The session is powered by digital version 2.0 JVWU Jaipur. Thank you. Thank you very much.